Hi, I'm Chun Hao, founder of Emacare. A company with just 1,000 employees loses up to an estimated of $10 million annually due to poor mental wellness. 76% of the employees perform below expectation, and it accounts for 10% of the total resignation. The increasing demand of our modern work life and COVID-19 have only made this problem more severe now than ever before. Hence, organizations are rapidly prioritizing the employee wellness. Unfortunately, existing solutions have low engagement rate, where more than 50% of the surveyed people stop using the app within the first month itself. The analytics are not meaningful nor actionable to the employers. At the end of the day, the employers are stuck not knowing what to do next. This is where Emacare comes in as a one-stop employee wellness care management platform. It does this in 4 looping steps. First, the platform engages the user through fun wellness activity that the users would love to use every day. Our emotion AI engine, Emma, will analyze and profile the user well-being through their interaction in these activities. Then, it will recommend improvement plan that is derived from the data-driven analytics to the employer. And finally, it will take one step further by providing a holistic well-being care with additional wellness services from third parties through our marketplace. The magic behind Emacare is our patent-pending emotion AI engine that learns about the user through this data to generate analytics and well-being profile of users. It will match and personalize a curated list of wellness activity based on their need. And as the user continues to use the platform, Emma will continue to learn and adapt the recommended wellness plan to improve the user well-being effectively. This is a huge opportunity where the global market is estimated at a $50 billion, and we target to launch in Singapore for a market estimated at $4.6 million. Emacare is on a B2B SaaS model with an annual subscription fee based on the number of subscribed users. We also take commission for third-party services engaged through our marketplace. We already have a strong start through our collaboration with NUS and Singapore Association for Mental Health, SAMH, a leading organization in the mental health space. We plan to conduct pilot run with them in Q1 2022. And through this organization, we will gain a large exposure of up to 50,000 from the start. This will give us a huge head start by giving us a large validation that will drive the design of our solution and also give us a large and unique data set for our AI engine. This will help us to stay ahead of the curve. I have 10 years of experience in leading and building tech and AI solutions that are being used by millions of people daily right now. The team is also backed by strong advisors from the industry and medtech space. We would like to reach out to investors, customers, and also partners that would be interested to work with us. Thank you, and looking forward to speak with you soon.
We've just heard from Chun Hao, Chief Executive Officer of Emacare. Hello, Chun Hao.
Hi, Juliana.
So, thank you for your pitch. I've got some questions for you. I want to know what makes Emacare different from other well-being apps in this space.
Thank you, Juliana, for the question. So, our activities are all specially designed with experts to ensure that it's not only promote wellness, but more importantly, it's something fun and highly engaging that the user will love to use every day. For the employers, they'll get to see a holistic view of the employee well-being then using our simple yet deep analytics. And combined with our Emma recommended action plan, they'll get to provide effective wellness care to their employee, not only on individual level, but more importantly on a macro level across organizations.
Thank you. Actually, this is a space that needs a lot of disruption as well, because in the COVID-19 pandemic, there have been a lot of cases of, COVID-19 anxiety, stress, of course, linked to the virus. So it's great to hear that Emacare is working on solutions in this space. However, most of your competitors in this space are B2C solutions. So why is Emacare targeting enterprises instead?
Yeah, that's correct. Employers has become much more aware in the recent years of the huge impact that the wellness has brought, employee wellness has brought to their employee and performance at their workplace. Therefore, with the COVID-19, it has accelerated this effect several times more with the changes and challenges that it has brought to the workplace landscape. And being work being a major aspect of an adult life is certainly the key contributor to an individual well-being. Therefore, right now is definitely the right time for being the right business approach and solution for Emacare to fill in this gap in the B2B space.
I completely agree with you, Chun Hao, and I think this is a space that you definitely would do well in. So one more question for you, and it's a difficult one. I hope you're prepared. So, how is Emacare taking steps to make sure that the privacy of data data is being protected in the first place?
I'm so glad you asked this very important question. So from day one itself, all aspect of the platform is designed with Emacare being a user safe haven in mind. All the user data will be pre-processed locally on the user device, and only metadata will be sent to our server in an aggregated manner. And therefore, no data will be traceable to any individual by either Emacare or their employer. We will comply with major data privacy regulations such as GDPR and PDPA. And most importantly, we are also engaging HR leaders in the design of analytics to ensure that not only it remains meaningful to employers, it also protects the individual interests of the employees.
That's very good to hear. Thank you very much, Chun Hao, and I wish you all the best this afternoon.
Thank you, Jelana.